A 50-year-old woman. Her menstrual cycle was sometimes long and sometimes short. For more than half a month, the menstrual flow varied, sometimes heavy, sometimes light. In recent days, she had developed trembling of the limbs, with the onset and duration of the tremors being irregular. She also suffered from general body pain and discomfort. Their complexion would intermittently turn red. The redness would come and go in waves. The patient felt as if there was internal heat baking her body, accompanied by sweating. In addition, she experienced insomnia, a bitter taste in the mouth, and thirst with a preference for cold drinks. Her tongue was red with a thin yellow coating, and her pulse was wiry and slightly rapid. The physician judged that the patient had excessive internal heat, while the muscles and skin were simultaneously attacked by wind, with the onset and duration of the tremors being irregular. Based on this assessment, the doctor prescribed a formula derived from Biao Jiak Gui Ji Tong. Prescription for 1 day: gypsum, Shi Gall, 30 grams, Anamarina rhizome, Ji Mu, 10 grams, cinnamon twig, Gui Ji, 10 grams, non-glutinous rice, Jing Mi, 10 grams, honey fried licorice root, Ji Gan Cao, 10 grams. The herbs were combined and decocted into a soup, which was divided into 2 doses and taken over the course of 1 day. The physician prescribed a total of 3 days in medication. Second visit. After taking the medicine, the patient no longer experienced trembling or body pain, and her sleep had improved. However, she still preferred to drink cold water. In the second prescription, the physician removed cinnamon twig, Gui Ji, and added Rehommonia root, Sheng Di, Scrofularia root, Xuen Shen, dragon bone, Long Gu, and oyster shell, Mu Li, without specifying the dosage for these herbs. The patient was given 6 more days of medicine. After completing all the herbal treatment, all her symptoms disappeared. Note: Biao Jia Gui Ji Tong is a classical Chinese herbal formula used to clear internal heat and relieve restlessness. In this translation, all traditional formula names, herbs, and Chinese medical terms are kept in pinyin with tone marks to avoid misunderstanding. Reflection. After the first prescription, the patient still preferred to drink cold water. The physician did not explain why. Viewers may reflect on this point. What might be the reason for her continued preference for cold drinks?